This episode was originally recorded in early 2024. You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Hey everyone, welcome to another episode of Pharmacy, IT, and Me. I'm your host, Tony. And on today's episode, we have a special guest and software engineer, Dr. Khanh Theresa Mai. And how are you doing today?
Hi, I'm very good. Thank you for having me, Tony.
Yeah, of course. And, I'm really interested to kind of talk to you more about like your career path and what you're doing, because it's very different than a lot of the folks I've spoke with in the past. So, this is a pharmacy informatics podcast, but I do want to also highlight like the health tech side and just how pharmacists can kind of move into like different areas.
Yeah. I would love to share that with you. It's been an interesting ride.
Yeah. I've seen you all over like LinkedIn, and also like some other folks interviewing you, like Dr. Beju Shah. So it's really cool.
Yeah, thanks. I try to share their experience because I know it's very non-traditional, and I made a lot of mistakes along the way. It took me a very long time, and it could have easily been cut down by a few years if I had not made the mistakes that I did. Yeah.
Yeah, but I mean, that's how you learn, right? So making the mistakes to learn. So, before we kind of go into like the weeds of like, what you're doing today and things like that, can you tell listeners a little bit more about yourself?
Yeah, sure. So, like Tony said, I am a pharmacist by trade, but a full stack engineer at the moment. So I graduated from pharmacy school in 2018. And at that point, I had been working at the hospital for about 7 years. So I decided to try something new, and I applied randomly to a pharmacy informatics job. And that's how I initially got into the tech world. And upon working that job, I realized how much I really enjoyed working on the technical side. And long story short, I randomly applied to a scholarship, like a career transition scholarship. And I won, and I took that as a sign, as a green light. So I quit my job, did a boot camp, and here I am. A few years later, I think like 3 years later. Yeah.
That's awesome. So, when you went to pharmacy school, did you know at all, like, this area of, you didn't mention you started off in informatics, but did you even know that was a thing when you were in school?
I did not know informatics was a role, like an actual pharmacist role. And I'm glad you brought that up, because when I was in pharmacy school, and I had started in 2012, so I was held back a few times because I just could not find my passion for it. I got in because I was very good at science, and I applied because it was the easy way and I didn't know what else to do. And I did really well in undergrad. So I was like, I might as well do this because I don't want to, hold off on getting into a career. So I got into pharmacy school, and I just could not find my passion for it. And throughout the whole time, even working at the hospital, we interface with so many different kinds of technology. You like the robotics machines, filling systems, POS systems, like Epic, so like your EMRs and stuff. And we work with so many types of different technology. But at the time, at least at Creighton University, the pharmacy curriculum didn't have one bit of technology in it. And I just found that very strange. So, and you're working with these technologies, and you're running into so many bugs and issues, and you can really tell that they had no clinical expert on the team when they were building it. Like it's clear that the engineer doesn't understand the clinical flow. And so a lot of that plays into why we're so, anti-learning or like integrating new softwares, because it's really difficult to take in, and there's a learning curve with all of it. So when I was at Creighton, I made it a point to bring it up a lot that we really needed technical classes, at least in the pedagogy somewhere. And so my fourth year, when I was doing rotations, I did one of those education rotations. So I shadowed, or my preceptor was a professor, and I shadowed him, and I wrote my term paper on how bad healthcare tech was and how behind it was. And a lot of it has to do with how pharmacists don't get any sort of technical courses in their curriculum. Even like a basics coding class or like a computer system class would be helpful. And yeah, one of the cool things that I got out of writing that research paper was, okay, so I wrote it in 2017 and I included a stat that was by the year 2030, 85% of job roles will be new, completely new, because of how exponential technology accelerates. So, are we going to stay in the 15% of job roles because we can't, advance and adapt to technology? I think that's crazy. So, yeah, I didn't know anything about technology or anything during my curriculum, but it was something that I thought about all the time.
That's interesting. Yeah. Like it's interesting to hear that at the year like 2017 when you wrote that, that was still an
Yeah.
issue. Yeah,
Yeah.
I graduated in 2012 and yeah, we barely had anything like that either.
Yeah.
I know that around 2013, at least in California, we kind of started having some of it added to the curriculums, and I came by to some of the schools guest lecture, but it was
Yeah.
still like, elective or like one
Right.
lecture here and there. It wasn't the full curriculum.
Yeah, I did look into part of the research paper was comparing top pharmacy schools and their curriculums. And a lot of the top schools includes really at least at the time novel subjects for electives like pharmacogenomics, a lot of technical courses. And I think that really tells a lot about why they're the top pharmacy schools. Whereas Creighton, no hate, love you, it's my school, but we were very focused clinically, and that's a very traditional outlook that I think is a majority of pharmacy schools.
Yeah, and I mean it makes sense because, part of
Yeah.
passing the boards too is, you got to know your law and your clinical, right?
Oh,
So,
yeah.
yeah. I mean I get it too cuz like
Same.
yeah, when I went through school too, it was focused on that, and it's because, our degrees of PharmD is, provide patient care. So that
Absolutely.
yeah. It's just like where's the time, right? Where's the time to put it into the curriculum?
Yeah, yeah, I absolutely agree. I agree with you 100%.
Yeah. So, and you actually mentioned you went to Creighton. Did you do the on-site like Creighton program, or was that the?
I did, yeah, I did
Okay.
do the on-site.
Okay.
I believe I was there around the time when they started doing, like, virtual courses, so
Oh,
that
okay.
was really cool. That's something that I sorry. That's something that I also discussed, was how if we're gonna do things virtually, we also need to take into account, how we work with technology because, those virtual students are getting a different experience, and we wanna give them the exact same one. So, I know that was one of the complaints that we were getting from virtual students at the time. So,
I see.
yeah, yeah.
Yeah, I met like a couple years ago. I did meet someone that went through the distance program with Creighton, and it was interesting to hear like they still go on site, but not as often, and most of it's
Uh-huh.
like away and self learning, and always interests me about like. But then that was like
Yeah.
before this whole COVID thing, right?
Yeah, that's true, that's true.
So
Yeah, I love that distance students were given the opportunity to even get a degree like pharmacy at such a, like, prestigious and well-known school like Creighton University, and they would come in the summer and do their labs then, and then throughout the year, they would, tune in virtually, to the lectures. It was really cool.
yeah, kind of ahead of the time because when COVID hit, that kind of
Right.
became the
Oh,
norm, right?
yeah.
So
Oh, yeah, it was totally ahead of their time, which is, really cool to say.
yeah. And you kind of you mentioned about like going into like the pharmacy informatics route, right? Like when you were an
Mhm.
informatics pharmacist, what were you doing like in that role when you were there?
Yes. So, it's funny because pharmacy informatics, it's actually not very new at all, you know? I had a colleague that had been doing pharmacy informatics as a pharmacist since like the 90s, but it's still so undefined that you will not find one pharmacy informaticist doing the same as another. Like the job roles are completely different. In my case, I helped manage Nebraska's PDMP, which was so much fun. Like that was really, really cool to see all that data and work with all these different data silos and not just working with one hospital's data, which is what I was used to. I was looking at the whole state's data, pharmacy and hospitals.
Oh, wow. So you were those are huge data sets. So what were you doing with them, I guess?
Yeah, we were wanting to help increase the access to this kind of data. So we helped integrate the database into major EMR systems like Epic. We helped merge with them, and then Cerner and all these other like all scripts and stuff. And so we would integrate the system so when a pharmacist is filling, they can easily click or trigger a component that will open up the data while they're filling, and it'll immediately pull up the patient's filling data. And Nebraska is a state where it includes all the data, not just opioid data for their PDMP. So it was a really great way to do med reconciliation for any sort of transition of care stuff that you need or new patients. And it was also really great for filling and seeing all of the patient's medical record right in front of you. Another thing we were doing is we were also, because pharmacies have to send reports on what they filled that day to the PDMP. And so we were integrating our system into pharmacy filling software so that they would automatically, at the end of the day, just send their reports then. And at the time of me leaving, we were going up to even a real time kind of sending reports. So anytime they filled a script and delivered it or the patient picked it up, then we would automatically get that data. So that was really, really cool.
I think like what's really cool in general here is that a lot of the roles of informatics pharmacists going through residency, PGY2s, a lot of them are focused on like the hospital health system side when you hear kind of like informatics pharmacists. But
Okay.
like that
Yeah.
role that you're talking about, like what you were
Yeah.
doing is so different, I guess. And it's still informatics, but like you said, every informatics pharmacist is doing something a little bit different.
Yeah, absolutely. I didn't know that the PDMP was even managed by pharmacists, at least in Nebraska's state. I don't know about other states, but I'm pretty sure other states also have like a pharmacist that's on board. Because I remember we were also talking about interstate data sharing, and we were sharing since we were Omaha was so close to Iowa, like right at the border, right across the river. We were also integrating our software with Iowa's PDMP, and we were talking to pharmacists there. So yeah, it's a really niche role, very important role, and also very rare, but still same title, same job role, pharmacy informaticist.
So in that role, like, did you actually need to know any of the coding aspects of it, or did that come later through your boot camp for your other
Um,
roles?
when I applied for the role, I had been self-teaching myself Python for a few years.
Oh, okay.
When I interviewed, they loved the idea that I was doing that. But in my role, I didn't do one bit of Python coding. What I did do was I learned SQL or SQL, so a database language. That was really important. I also used a lot of Excel and CSV, which is also common in software engineering. And we would also I would at least see a lot of JSON data. I didn't actually use any that code to parse JSON data, but it was something that I recognized, which was really important for me to transition from informaticist to software engineering. And another thing that we were learning is ASAP, which is like a automation pharmacy PDMP kind of language. I can't remember exactly, but it's different than any other language, but it's like a specific pharmacy language that I did learn on the job, and that helped me work with the PDMP's database.
Oh, that's really cool. Yeah, of course, like SQL, everyone has to
Yeah.
know that for healthcare data.
Yeah, that's one thing that whenever I get asked, like, if I want to become a pharmacy informaticist, what should I learn? What language should I learn? And I'm always like SQL.
Yeah,
No matter
I don't
how
think.
undefined the role is, if for some reason we always work with SQL.
Yeah, I don't think like I've ever been in like any kind of informatics space where SQL was not involved.
Yeah, same.
So
I agree. Yeah, so that's like the key one right there.
yeah. And then like, after your informatics role, like you did mention about like switching over to the full like, technology engineer side, right? Like,
Mhm.
like full stack engineer. How was your how did your pathway kind of like go that route?
Um, so I had always had the intention of not completely dropping my pharmacy degree and expertise. I wanted my goal was to take my pharmacy degree, go into the boot camp, learn software engineering, and then take both and try to get into healthcare tech. And that was where a lot of mistakes happened because I just didn't know how to sell myself and I didn't have the network that I needed because everyone in tech will tell you it's a lot about networking and I didn't have any of that. Like my whole LinkedIn network was just clinicians. So I to get into tech at least, I got a job at a startup called Revenue Cat, and they were working with mobile applications, so had nothing to do with healthcare. But the important part was that I got a lot of experience there, and I learned so much there. I got very lucky with that job. And they just really liked the idea that I was a pharmacy informatics um like career path, and they really liked that I was driven enough to change my career, so they saw the passion there. So they gave me a chance, and thank God they did, because getting your foot in the door initially is the hardest part. And although I would have rather have done the boot camp and gotten into a healthcare startup right away, I would never change what happened for myself because of how much I learned at Revenue Cat and how great that they were to me. So after Revenue Cat, I ended up getting laid off, which is huge part of the technical space. And I took it as like a little hazing thing. Like this is just software engineering. This is what happens. That's one of the downfalls because pharmacists, that's such a concrete position, and they everyone always needs a pharmacist. So job security is huge there. But in the technical space, the turnover rate is so high. So that's one of the difficult things that I've had to deal with. But if it was not for that being laid off, I would have never got into or even known about MedGeo. And now that I'm back in the healthcare space, it's really, really nice to be able to finally exercise both of my knowledge sets. So being able to access my clinical knowledge on top of my coding knowledge and using both together, this has been so rewarding for me.
So, like when you were talking about the hardest part is getting your foot in the door.
Mhm.
How do you suggest someone that is looking to go from a healthcare space and going directly into an IT role? What do you
Yeah.
think they should do?
Yeah. So I always tell the people that I talk to that breaking into tech is like three things: luck, networking, and selling yourself. The selling yourself portion for those of us in healthcare is harder because we don't have that technical expert or that technical experience, professional technical experience that they want. And I say professional because there are people that self-teach themselves code and will write like personal projects and stuff, but that doesn't count as professional experience to recruiters. So, selling yourself, for instance, how I got my informatics role in the first place, even though I had no experience at all, was I sold myself by mentioning that I was a self-taught Python coder, that I would customize dashboards for myself and my colleagues on the Epic EHR system. I would troubleshoot the McKesson tech that I was using at the pharmacy, and also integrating a lot of the technical language, which is very hard there's a learning curve there as well. But using the technical language is a very big deal because it just shows that you know what you're talking about. And so not only was I using this technical language, I was selling my professional clinical experience as professional technical experience, which it wasn't. But I mean, it sounds a lot better than someone that's like, I built this personal project on whatever, etc. So yeah, selling yourself is a big part of it. So I recommend to anyone that's even thinking about this, while you're working at your pharmacy job, while you're interfacing with all these different kinds of software, if you notice any sort of technical gaps, like, oh, I could have, like, this doesn't follow a clinical flow, they're adding like an extra step, this is silly, or anything that you find that would really enhance the workflow or program at all, I would write it down because I had so many ideas while I was working in the pharmacy. The 7 years I was working at the hospital pharmacy, I would run into so many bugs or so many enhancements or features that I would think of, but I never wrote them down. So then by the time I quit my job and started selling myself, I couldn't remember what those things were. And they would have made great talking points in interviews. So that's like my favorite advice to give right there. And I also like to recommend to look for jobs during Q1 and Q2 or quarter one and quarter two, which is the first half of the year because that's hiring season for startups or technical domains. But creating a technical resume. So as you know, pharmacists, we have a CV, and in the academic and professional world, the longer the CV, the more publications you have, the better, etc. Technical resumes are the complete opposite. Like technical recruiters, if it's more than one page, they are like, no, you have 6 seconds to sell yourself in a one-page document. Having a whole CV, there's no way they're going to even look at it. So making a technical resume from your CV, and you can definitely include all of your healthcare roles, but using the technical language rather than the clinical language is a really important part there. And including all the software and systems that you utilized into your technical resume is also very, very important.
So I like what you said there. Two things I want to kind of comment on. One is the part where you were talking about like resumes, keeping them updated with the task. I like that because I also do that myself and recommend my students to do that
Yeah.
because it's like anytime you kind of finish something, you should just update your CV right away just so that it's
100%.
there. Yeah.
Yes.
Um,
100%. I totally agree with that.
yeah, because I sometimes even myself, like I forget if I don't update it now and then a week later I'm like going back to update and I'm like, wait a minute, what was it I was doing?
Yeah. Yeah, and some of
Yeah.
these things that you, like, wanted to add onto it is, like, absolutely critical, but
Mhm.
then you forget, and then they all add up, and by the time you need to update your, resume, you have all these things to add, so definitely add it when you think of it.
Yeah, and then the second thing I wanted to comment on was about keeping a technical resume, which it sounds daunting, but
Mhm.
I also do that too, and I keep like a separate CV and a separate resume and kind of
Same.
update both like concurrently, you know?
Yeah, same. I do the exact same thing. I actually have 3 documents. I have my professional CV, I have a technical resume, and then I have a running technical resume, and this is something that I learned at Hackbright, the boot camp that I went to. So, in order to help streamline, that, 6 seconds that I talked about that you have to catch a recruiter's eye, when you see a job role for a technical position, they'll often list what kind of software they want you to know or at least have some familiarity with. My running technical has every piece of software or third party system that I've ever used in my life. And then when I go to apply to this position, I'll cut all of that up and then make that my technical resume. So I only include what they want.
Oh, that's a really good idea.
Yeah. It helps like catch their eye. And I also
Yeah.
heard about how, HR systems, they have like a parsing thing where they take words that they want and it helps them go through all of the applications that they have. So then they can pull out applications that match all of the keywords that they want. Have you heard about this?
Yeah, actually I have, and I think that's one of the things too. There's a recommendation of like don't make your resume too like fancy and
Yeah. Yeah.
format it differently. Otherwise, these parsers do
Yep.
not work.
Exactly. Yeah. I remember when I first got out of pharmacy school, I made like this really fancy looking CV through like InDesign or Photoshop or something, no way will like
Yeah.
some AI system be able to parse that. So I just keep it like a very simple Word or PDF. I think Word would go better, but a simple Word document so they can parse through it easily.
Yeah, I think like Word document is the best. PDF's kind of the second best.
I agree.
I think like, well, for me, for my resume stuff, like on the keeping it 1 to 2 pages, I use something called flowcv.io. It's
Okay.
free. I'm just throwing it out there
Nice.
in case anybody wants to like check it out. Not
I'll check
sponsored.
that
I
out.
just use it.
Yeah, no, I
So
love that.
yeah, it's nice. It's nice to like keep things organized and kind of follow like a still like a proper flow. And then
Mhm.
I think it's also like one of those things you have to do in case you want those parsing systems to work.
Yeah, yeah,
So
yeah. That's a great idea. I love that.
yeah, but getting back into you getting into your technical role, and then you were working as a. It's interesting though, like you're actually your title is a full stack engineer. So
Mhm.
what kind of education, what kind of training, what kind of experience did you have or gain in that time period before you became you know
Yeah.
an actual full stack engineer?
Yeah. So, for my pharmacy informaticist role, I did a full stack engineering boot camp, but then I became a front end engineer, and now I'm a full stack engineer now. So, the logic behind that is that front end engineering is much easier to get into. The barrier to entry is so much lower than full stack or back end or any other. I say that like loosely, but any other role because front end is so much easier for entry level employees to like integrate themselves and adapt themselves into the company, and that has a lot to do with how and just as a background, so everyone understands, back end is the database, front end is everything you see on the web page or web app or whatever you're building, and then full stack is both together. So backend is well known for being very difficult to get into because it's the whole database. Like anytime you see Facebook is down, a backend engineer messed that up. Like they deployed some sort of change and it wrecked the whole thing. Whereas when you deploy or ship a feature on the front end, it's just like a little visual change, you know? A lot of people won't even notice. It won't break the server, it won't break the system. So that's why it's more fragile. And more entry level employees are able to get the hang of things and make mistakes and learn from them. And it's okay. No one will notice. So, that's another tip that I like to give if you're trying to get into a role, look for a front end role because they're a lot more flexible there. But full stack is kind of like the gem of software engineering because it's front end and back end, and they are the complete domain expert when it comes to everything that that web app entails. And yeah, to be honest with you, completely forgot your question.
Oh, my question was just about your training, and
Ah,
you answered it,
training.
about
Okay,
yeah.
okay, good. Yeah, yeah, yeah. So, I also built a lot of my own projects, mobile apps and web applications, which entails both front end and back end. So, pharmacy informatics has a lot to do with the database, which is why back end was easier for me to understand.
So, with all that experience in your projects too, I kind of want to delve into a little bit about your kind of side projects. There's one in particular that I
Mhm.
know you launched a while ago, and I've been kind of just silently following it. Is
Yeah.
your PharmDs and IT project?
Yeah.
Yeah, you want
Um,
to describe that a little bit?
Absolutely. It's my favorite project. I love it. I wish I could spend more time on it because I would really love to get that shipped out right away. But it's pretty much like if you've applied to technical positions, you probably know of the website Well Found. It used to be AngelList, but it's kind of like LinkedIn minus all these social media components, and it's just technical job roles. So, it's kind of PharmDs in IT is like Well Found, or it's like LinkedIn minus a social media component, but just for clinicians. So I integrated some APIs like Lever, Greenhouse, those applicant tracking system APIs. And I pretty much just included all the healthcare tech companies that I can think of, that I can find, which is thousands, because I also integrated Crunchbase, which is kind of like another website that tracks companies. But I pull out the keyword healthcare and in the Crunchbase system, filter that data by healthcare. And then I pull out all those companies and I pretty much just render all of their job roles that are open. And the beauty of it will be, and I haven't built it yet. It's still in the works, but I have the data model built, which is a lot of the work already. But the cool thing about PharmDs in IT is that you'll be able to filter by your speciality. So one of the gripes that I have with getting into the technical realm, healthcare technical realm, is that we don't have that professional experience, like I said before. But if we can fill that gap by saying, oh, but I've been doing ambulatory for 5 years and you're an ambulatory startup, I already know exactly what you need. So you'll be able to filter by specialty, ambulatory, if you're like in billing or if you're in home healthcare, medical devices, whatever, you can filter by that. And then it'll pull up those companies that are related to that specialty. And then it will render those jobs for you.
That's really, really cool. I think I saw you posted about it a couple months ago.
Mhm.
No, weeks ago maybe.
Yeah. It's like off
Yeah,
and on because I'm as much as I would love to focus on it forever. The
yeah,
updates have been slow, but yeah, I did a few weeks ago post an update.
yeah. I think it's really cool. I don't know by the time if people are listening to this episode, it will be out yet or not, but it's a
I
really
hope
cool
so.
tool. Yeah,
Yeah,
I think I'll put a link. Actually, you know
yeah,
what? Yeah, I'll put a link to your LinkedIn actually in our show
yeah.
notes so people can kind
Great.
of just follow you on
Yeah,
that.
PharmDs and IT. I also made a LinkedIn page for that,
Mhm.
so I can give you that as well. But it's also at pharmdsandit.com, which is the current domain. It's not completely deployed yet, so it says in maintenance, but it will be hopefully by
Okay.
summer.
Okay, cool. Yeah, I'll put that in our show notes. And just before we wrap up, I wanted to just check in again. Like, is there any last advice like you want to give to people interested in kind of going that similar path with you, going into like healthcare IT and being a full stack engineer?
Yeah, yeah, thank you for this opportunity, by the way. But I would just really love to say, like, if you're on the fence and you're like, yeah, I don't really know if I want to do this. I really love technical things, but I don't even know how that translates to the technical realm. I just really like say there are so many parallels to pharmacists and software engineering. Software engineering, it's all about being efficiency obsessed and finding solutions. And that's what pharmacists do. A lot of the work that I do as a software engineer on a daily basis is looking at API documentation and how I can use that in my system. We look in documentation every day, lexicomp, drug monographs, etc. Just knowing how to navigate those documents has helped me so much on how to navigate the API documentation for what I'm looking for and finding a solution right away. Being able to push away all of the noise and pinpoint exactly what you need, that takes a little bit of practice. And our skills as a pharmacist are totally built towards that. Another example is that the file tree for an application, it's very convoluted, very complex. It completely mimics the human organ system. And as a pharmacist, when we're doing medrecs or drug verifications or anything like that, we have to think of all of those systems and how they're impacted. Well, as a software engineer, when I have to add a new feature or if I have to fix a bug, I have to look up the file tree and down the file tree to see what I do is not interfering with anything else. And there's even a word for that. in software engineering. It's called regression testing. You ship a bug and then you have to do some regression testing and you have to go back to see where you messed up. And it's because you didn't think of the whole system. So I think being able to wrap your head around the whole system and then, but also focusing on what you need to do and what the primary thing is, which is the drug you're trying to verify or the bug I'm trying to fix, it totally plays into these job roles together. They mimic each other very well.
Awesome. Yes, thanks for sharing that. If people wanted to like reach out to you and maybe ask more like questions specific about your career or
Mhm.
what you're doing or even like PharmDs in IT, what's the best way that they can reach out to you?
Yeah, I'm always available on LinkedIn and which I'll give Tony the link. I'm also on email. You can email me at conmai@creighton.edu and I can also give you that. Always available, always happy to help. And yeah, I'm around, so you just have to find me.
Awesome, awesome. To be respectful of your time, thank you so much for being on the podcast today and sharing, all this information. It's really great to kind of hear about it and also like learn more about your career path. And thanks again for sharing.
Yeah, thank you so much, Tony, for having me. It's been a pleasure.
Hope you enjoyed this episode of the Pharmacy IT and Me podcast. If you did, please rate us on Apple Podcasts or Spotify or anywhere you're listening to this podcast. It really helps us reach more people who might be interested in learning more about pharmacy, informatics, and technology. If you would like to suggest a topic or somebody to be on the podcast, feel free to reach out to me on social media. I can be best reached on LinkedIn. Until next time, remember, technology is the tool, patient care is the goal.